Good morning. One of the more frequent questions I receive regarding deep plane facelift is, what is the recovery like? And that's a reasonable question because it is surgery. We treat it like surgery. There is surgical recovery. There's very little pain that's associated with it. A lot of patients have difficulty understanding that, and it's sort of a process you have to go through. Sometimes it's helpful to speak with previous patients to see what their experiences were. We're going to try to provide videos of patients who come in post-operatively and show you how they're doing, what they're feeling, things of that nature, so you can understand it. But the way I would explain it is there's two initial phases of recovery. There's physical recovery to the point where people don't really know that you've had a procedure. And then there's what I call psychological recovery. So physical recovery means swelling, bruising, things of that nature. So you'll have some sutures in place for about a week, okay? We then will see you at 2 weeks, during which time we'll probably clear you for makeup if you choose to wear it, to help conceal any remaining swelling, things of that nature. We ask that you not bend over or do any forms of physical exercise for 2 weeks. And you can start light cardio at 2 weeks. Then at 4 weeks, if you do, let's say, weight training or circuit training, something of that nature, we say that you can resume those types of activities at that time. Then there's psychological recovery. Okay, so psychological recovery means when you feel good about how you look, and that can vary from patient to patient. Some patients look great and feel great, and you can really see the confidence in their eyes. And some patients look great, but they don't feel at the time that they really look so well. So that's what the job is of my office staff, is to sort of show you or to explain to you that things that you're experiencing are normal. If they're not normal, we'll obviously want to see you. But for the vast majority of patients, there are similar concerns about recovery and the recovery process. And because it is actually a little bit of an evolution that follows a 12-month course, we'll see you for a year after the procedure. And you know what I'm going to do next is I'm going to post a couple of photographs of patients in various stages of recovery. The first 3 patients will be at 1 week, 1 week, the same patient then at a month, a patient at 2 weeks, and then a patient at 6 weeks. If you have further questions, don't hesitate to call us in the office. Thank you very much.